Greetings. Today is Tuesday, March 24th. It's not time to stop precautions, as we know community spread has occurred. In order to protect lives, we need to continue staying at home except for essential trips, washing hands frequently, and practicing social distancing at all times. Many of you have asked what to do if you are experiencing symptoms such as high fever and cough. I've also heard concerns about what's being done to prepare, as it's possible that more people will become ill. We are working closely with the health department and our local hospital to ensure individuals who may become sick receive care. I'm joined today by Bill Grimes, Vice President of the University of Maryland Charles Regional Medical Center, to provide more information about your local hospital's response and efforts. Thank you for joining me today.
Thank you. I think that when people talk about the response, one of the things they need to know is that we haven't had a pandemic in 100 years. So for many of us, this is the first time we've seen something on this scale. We're working our way through it, but there's lots of good resources coming to bear on the problem. And the really important thing is people need to know, don't panic. We're going to get through this, and we'll all get to the other side.
What has the hospital been doing to prepare for responding to this emergency?
There's a number of things. In some respects, we're lucky because we've been able to see this coming. Not had a lot of time to prepare, but it's given us some time to get things in place, policies, procedures, and practices. And working as part of the University of Maryland medical system, working with the county government and a number of other organizations, we've established our incident command system. And you may ask, what does that mean? That's the structure we use as a hospital to respond to emergencies. It allows us access to a number of different organizations and opportunities for supplies and things of that nature. It's given us the time to, with the forewarning and incident command, to start establishing quick and efficient communications with our partners, both at the local level and the state level, and even some cases at the federal level. We're getting a lot of information right now from the CDC and other organizations. It's also allowed us to really focus on the efficient allocation of our resources. And our resources take several different forms. We certainly have supplies, masks and gloves and gowns, the things you hear about in the newspaper. We have the staff, which is the most important of all the resources we have access to, and then also equipment and additional training and all those other things that time gives us the ability to put in place. However, it has made us aware of a couple things. We have critical shortages in certain types of equipment. We have critical shortages, not as just, and I'm not talking as a hospital, I'm talking as a country in our supply chain, where we get the PPE. You hear, PPE stands for personal protective equipment. This is the masks, the gowns, the gloves, those things that keep both the staff member as well as the patient safe. So we've been working on those, making sure we have adequate supplies to do all of that. And that's what the gift of time has given us locally. They have not had that in other places in the world. Italy is a perfect example. New York's getting hit pretty hard right now. But we've taken that time, that, I don't want to say luxury because that's the wrong word in this scenario, but we've taken that time and built those things up. The couple things we have done immediately, we have put a highly restrictive visitor policy in place to try to reduce traffic in our hospitals. We know it's inconvenient. We know being in a hospital is scary for both the patient as well as the visitors. But it's something we feel we have to do to keep everybody safe and preserve our resources. We do have a vendor policy in place restricting their access as well, the vendors that we have coming into our hospital. And this could be anything from a plumber to someone helping out with implants for the surgery. It's a wide range of vendors in a hospital. we've taken a restrictive policy on them to try to keep them out as well, once again, to protect everybody involved. We are putting tents up in front of the hospital. When I say the front of the hospital, it's really in front of the emergency department on Wacomico. Not because, as I've heard rumors, we're going to house patients there. That's not the plan. What we're going to do is triage patients. We may perform some treatments of patients who are receiving treatment on an outpatient basis, meaning they're not going to stay in the hospital. This way we can keep them out of the hospital, check them to see what's going on, and then direct them to the best place for care. If someone has a mild or minor case of COVID-19, we can possibly take care of it in the tent and not bring them into the hospital and expose more people.
You are dispelling, one of the biggest concerns that I've heard in the community, and I think that's extremely important to really emphasize the point that you're making, because there's so much misinformation that is in the public right now, and that's why I appreciate you really detailing, what that actually means more than anything else.
Well, I'm happy to do so. There is a lot of stuff on the internet. You can't believe everything you read there. There are some good resources out there. The CDC, the state, the county has some good information. All of that's being worked on, and we have new information being updated, hourly at times. We're learning a lot about this disease. We're learning about how to respond to it, and that information's going up as fast as possible. And we all like to use Facebook to stay connected,
right,
but some of the most accurate information does not circulate on Facebook.
Right.
So, but going back to these tents, you're going to see them out there. Mm-hmm. It's going to help us keep the place safe. I know people have asked us about when are you going to do walk-up testing. I want to know if I have COVID-19. Unfortunately, at this time, there's not enough test kits. So when I say test kits, this is really a sample kit where we would take the sample and then send it to a reference lab. These are big labs that have a lot of high-end equipment. This is a molecular test. It can't be done in a hospital. Unfortunately, the world of hospitals is not all Grey's Anatomy and Chicago Med and all of that kind of stuff. A lot of these tests take longer to get back the results. It can't be done in a hospital. So there's been a huge backlog to those reference labs. And a lot of us are familiar with them, Quest or LabCorp, ARUP, some of the other ones. But also getting the kits themselves has been very difficult. I know that, state, we've had some of our regions have gotten a number of kits and they've been able to do things, but that's been spotty. The allocation of these kits has not been, I don't want to say equitable, because that makes it sound like somebody's doing something wrong. It just hasn't been very good. Some places have a lot, some places have none. And some places have been able to do that, drive up testing. But at this point, I'm not aware of anybody who's just doing walk-up testing. It does require a prescription from your physician. And your physician's only going to give you one if you have a reason to have the test, if you're exhibiting the symptoms. And that's certainly what we're looking for at the hospital. We're not going to give a test to everybody. We're looking for a specific set of symptoms before we do them, because we don't have a lot. And the ones we do send out, the turnaround time has been high. So they haven't been really effective for us at this point in laying out a treatment plan. Fortunately for most people, the treatment plan is pretty similar to what you'd see with the flu. Not for everybody, but for a lot of people. So we've been able to help those people. Most people do not need to be, when I say most, a significant proportion, 80%, don't show anything other than mild symptoms, if any symptoms at all. It's that smaller percentage that need hospitalization and care that we can deliver they can't get elsewhere. I know that people are concerned. What do I need to know? What can I do? Pay attention to the information that's out there. And like I said, use reputable sources, the CDC, the state, the county. We're going to get more test kits. And we're already seeing the reference labs being able to come up to speed and get these things out there. Best thing for people to do right now is stay home. The information that's being good, the information that's being given is good. Stay home. Don't get into crowds, especially if you're elderly. And I'm like everybody else, as I age, my definition of elderly has changed.
Right.
But if you're above the age of 60, you really need to think twice about going out, and do not go out into crowds. And also, if you have any type of chronic condition, COPD, CHF, diabetes, hypertension, anything that may put you at risk, don't risk it. Stay home. Practice social distancing. This is the 6 feet away. And I checked, we're about there. This is a droplet type of spread, meaning droplets produced when you cough and sneeze and things of that nature. Reduce the chance to pick those up. And practice good hygiene. And that includes washing your hands a lot. That's one of the best things you can do. Wipe down surfaces and disinfect things that people come in contact with. So, hope that's helped.
No, that is tremendously helpful. And as a follow-up, and you did allude to it, but if a Charles County resident, felt that they possibly contracted coronavirus, what would you suggest they do?
The first thing they need to do is call their primary care physician. Okay? If they don't have one, there are other resources in the community, such as some of the urgent care centers and some of the other places. Now, just because you go there doesn't mean they're going to do a test. Okay? They're going to take a look at you or talk with you. We're seeing some telehealth is really making a show right now. But they're going to talk with you and figure out, do you really have the symptoms? And even if you did, are they severe enough to warrant going to a hospital? This is a virus. There's not a whole lot that we can, at this time give to you if you're suffering minor or moderate symptoms. There is no magic pill at this point. There is no magic treatment that we can give you. Most viruses run their course, and people are fine. For a select group, they'll need more. But talk to your physician, talk to the urgent care centers, and then let them direct you to what to do next. Going to the hospital because you think you have it, but aren't really showing any symptoms, is disruptive for the hospital, and you're going to spend a lot of time waiting there. And frankly, the hospital is where people go when they're sick. So if you're not really sick, the last place you want to be
is at a hospital.
Right. So we would ask that, practice good common sense. Listen and pay attention to what's being put out from the CDC, the state, as well as from the county. I think that's what they need to do.
Mr. Grimes, we're about to round this out, but were there any final messages you wanted to present to Charles County residents?
Well, I want to say thank you for the outpouring of support we've received from a lot of people. We've had a lot of people asking us. They know that our staff is under a lot of stress. And based upon what they're hearing in the rest of the country, they know it could get worse for us. But we really want to say thank you. It's been actually heartwarming about how many people at this point are already asking, what can we do? I think it speaks well of our county and the people who live here. So thank you.
We really appreciate your time and support as we work together to deal with this unprecedented public health emergency. Charles County government is working closely with many of our local partners daily to protect public health and deliver services while dealing with extraordinary challenges. Make sure you stay informed by visiting our county's website. Follow us on Facebook, Twitter, and on YouTube. And sign up to receive e-news and emergency texts and email alerts through our citizen notification system, also known as CNS. You should also follow our partners, the Charles County Health Department, Charles County Public Schools, and Charles County Sheriff's Office by visiting their websites and following them on social media for updates. As we conclude, I urge you to rely upon official sources, including the Centers for Disease Control and the Maryland Department of Health, to stay informed on the latest facts. You can find links to these resources and much more on our website at www.charlescountymd.gov. Thank you.